Today marks the annual global campaign aimed at raising awareness about diabetes. The chronic disease occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin that it does produce. This typically leads to high blood sugar or glucose levels. The World Health Organization says about 830 million people worldwide do have diabetes. Let's highlight the importance of this day, bring in our guests. Dr. Patrick Ngassa Piotie is the chairperson of the South African Diabetes Alliance, joining us via our video link. And with us in studio is Dr. Judey, Pretorius, Managing Director and Biomedical Scientist with Biomedical Emporium. To both our guests, lovely to have you with us and welcome to the SABC News Channel. Dr. Patrick, since I have the benefit of having Dr. Judey with us, I'll start with you. With just helping us place how big a problem diabetes is today in South Africa 2024, especially because type 2 of the disease is being described as a silent killer.
Thank you, Ayanda, and very happy to be with you in this beautiful day. Indeed, we describe diabetes in South Africa today as a public health crisis. As you rightly say in your introduction, the number of people living with diabetes are increasing every day. We are now sitting with an estimated prevalence of 4.3 million South Africans who are living with diabetes. And to make the matter worse, according to Statistics South Africa, diabetes is now the leading cause of death. So you therefore have a dangerous cocktail whereby we have many people who are living with the conditions. Some of them, actually 50% of them, are unaware that they have diabetes. And our public health sector is not coping. We have high level of complications and unfortunately high levels or high numbers of premature death. Therefore, we are sitting with a serious problem that needs our attention urgently.
Absolutely. And I suppose what makes it difficult, unlike a gauging wound, Dr. Judey, it's difficult to know when you get to a point where I think you develop diabetes, right? It's not something you contract. Typically, the telltale signs that somebody needs to perhaps get this checked, what are they?
Well, for where I come from, especially in the skincare industry,
right,
is like Dr. Piotie just mentioned, is many people are unaware. And I like to use the skin as a diagnostic organ that mirrors some of the things that happen internally and systemically. And some of the skin concerns that you can really take note of, and forgive me for using big names, but I'll explain it, are all of a sudden if you see skin discoloration, we call it carotenemia, or you see many skin tags that start to express on the human skin, or velvety plaque-like pigmentation under the arms, in the neck, even in the groin area, blisters, scleroderma. When you see there's a disorganization of collagen fibers in your skin and you cannot really straighten your fingers, or you lose sensoric activity on your fingers and your toes. And one of the most important ones are when you experience delayed wound healing and you bruise and you have shin spots with very particular rims on your skin. That's usually an easy sign to see maybe I have diabetes even before you go for certain laboratory tests.
Sure, interesting indeed. And you know, Dr. Patrick, as the team and I were trying to think about how we're going to approach today's discussion, so many people in the room could link somebody they know who's got diabetes or sadly has passed on because of it. And that's raised questions around what you reckon it is about perhaps even our lifestyles that is leading to the prevalence of a disease like this.
That's the reality, Ayanda. Unfortunately, I would assume that all families in South Africa and actually globally are somehow affected by diabetes. We all know somebody who is living or who has passed, unfortunately, on because of the condition. So the challenge here is that diabetes is a complex condition. And unfortunately, in our public sector, we are not often doing the right things in terms of managing. But let's go back to your concern in terms of why do we have high numbers of people contracting diabetes? Diabetes usually is about risk factors. We, unfortunately, in South Africa have high level of overweight and obesity. You might know that in terms of prevalence, In women, it's about 60-70% of women who are either overweight or obese, and in men, it's close to 40%. Therefore, you can imagine the magnitude of the problem we are dealing with. We have obesity and overweight. Age is as well a risk factor. We have our environmental factor, for example, the food you eat, the inability to exercise sometimes, or the unwillingness to exercise. Smoking can be a risk factor for diabetes, and so on and so forth. However, my focus as a public health expert should be societal. We should look into the society and say, what are those conditions that leads to the country, the population, the communities having such high levels of obesity? It's definitely the fact that healthy foods are inaccessible for the majority, and it's often difficult to exercise because you don't have access to a gym. You cannot safely go outside to walk any time of the day because of our high levels of crime. So as you can see, this is a whole of society problem that should require us as a society to take it more seriously and to find solutions that will fit the South African context.
Sure, those figures are staggering, Doc. And because diabetes is typically associated with glucose and sugar levels, many people think that it's sugary foods only that might lead to, at least exacerbating the disease. But we know that sometimes too much starch, things like pasta, dare I say even some of the rices we have, could also have an adverse effect.
Indeed. When we eat those food elements that you described, the body will break them down in what is called carbohydrate. Carbohydrate is basically the glucose of the body. That's the energy source. Unfortunately, when you have too much of it and you are not spending enough calories in a day, the body will have to store them as fat. And it's that accumulation of fat that leads to overweight and obesity, and unfortunately sometimes affects our capacity to produce insulin or to use the insulin that we are able to produce. So indeed, we shouldn't just focus on the cold drinks or on the cup of the teaspoon of sugar when we're taking tea. It's also the food we take. But you might agree with me that how many people can really afford a balanced diet?
Right.
Many people in South Africa, we know our high level of unemployment. People are blessed when they find a plate of pap per day. So you can imagine if that's why it leads us to being obese. So what do we do? Unfortunately, there are still interventions that can occur. For example, once is eating a plate of pap, we recommend to allow it to cool down completely first before consuming. That can help. But also we can look at portions. Instead of having a full plate, maybe reduce the quantity. And of course, if you can plant your own vegetables, or you can do as much as possible to include vegetables in your diet. The dietitians will be able to give more advice, but mostly it's about a balanced diet. It's about reducing portions. It's about making effort to eliminate either all those sugary drinks that we're consuming, or those foods groups that leads to us ingesting more carbohydrates.
Sure. Dr. Judey, I'm going to throw it back to you. I mean, you did, I think, was a great job at helping us look out for certain things in our bodies, specifically on our skins, in order to pick up if somebody, is diabetic. But how, from your own line of work, how satisfied are you that that kind of information is reaching the right people? Let me phrase the question differently. Are you finding that more often than not, by the time patients are presented to you, the symptoms have really gone into overdrive because they simply didn't know?
Absolutely. It's the don't know factor that really makes a huge impact, and how things spiral down from there. Just to add on to that conversation, one of the things, if you are on a high carbohydrate diet, one of the things that happen is there's a molecule in your body called triglycerides that also increase. And then all of a sudden people start seeing like these cholesterol deposits on their skin, and especially on the eyelids. And that's also a big sign for people to just realize maybe something is really wrong systemically. And I come back by saying your human skin is nothing other than a diagnostic organ to tell you something is wrong. One of the biggest thing, and also from a public sector point of view, that's really profoundly serious is diabetic wounds. because diabetes patients sometimes just bump their toe against a wall or a door and they don't feel it because they've lost all sensoric activity. And then that wound, because of the delayed healing and the injured blood vessels and so forth, it doesn't heal, and the wound becomes static, and the static wound becomes necrotic. They don't have access to products that they can apply topically, and it inhibits any form of circulation. And ultimately, those type of lower wounds, we call it lower wounds or diabetic ulcers, need to be amputated.
Wow.
I would also definitely like to add on to lifestyle changes. My plea would be to diabetic patients, if you are a smoker, stop, because smoking will definitely even further inhibit any form of circulation. And if you have a wound, which many diabetic patients struggle with, you want to prevent any form of amputation taking place.
Sure. Dr. Patrick spoke about the, I suppose, prevalence of diabetes obesity actually, amongst men and women, and it's obviously had me thinking about risk groups. In your line of work, are you finding that particular demographics are susceptible to, having some of those wounds, for example? I know in my own upbringing, we've always thought of people who are diabetic as being elderly, but I'm finding sometimes that that's changing.
It's definitely changing, and I think, poor us who's exposed to all of the food stuff and the processed foods out there, and kind of forced to only use and utilize or consume a very, very particular food stuff, and also perhaps a lack of information and education. But we are not excluded, and if you just look at the numbers, you can see many people are affected by this, and it does really call for some proper lifestyle changes, because it has a dramatic impact on your lifestyle and your life, and it's a very, very, very serious disease.
Absolutely. I wonder, Doc, from a public health perspective, Dr. Patrick, because you're both doctors, from a public health perspective, whether you reckon this, the state is well resourced to respond to what you have both described as a crisis. For one, do we have the insulin to go around, let alone just, the expertise to respond to people who need the help?
No, thank you, Ayanda. And I want to say a very valid point made by my colleagues. In terms of our response as a country, unfortunately, the statistics speak for themselves. We are not doing well. We are not finding people who are living with diabetes. We are not putting them on treatment. And for those who are on treatment, we are not managing them well. You need to understand that our health system for the longest time has been built to respond to communicable diseases, your HIV, your TB, and your infectious diseases. Unfortunately, diabetes is a non-communicable disease. It is a chronic condition, meaning you have a patient that will be in the system probably for many years. It's important that the data is followed. It's important that the monitoring is strengthened. Unfortunately, as it is now, you have facilities where every time the patient goes to the facility, they start a new spreadsheet or a new piece of paper to start back on his history. That is unacceptable. We should be considering strongly moving towards electronic records so that the history of those patients can be maintained, and the healthcare workers know who they are dealing with when they are sitting in front of a patient without having to go back to interrogate the patient with time that they don't have. But I will be amiss if I don't mention that indeed on this World Diabetes Day, we are celebrating diabetes and well-being. It's still possible when you live with diabetes to have a healthy, long life. I think it's also important that we give hope to the listeners at home, because around diabetes there's a lot of stigma, and there's a lot of fear, and there's a lot of misconceptions. It's important that we tell the public that once measures are taken, first it starts with yourself. The patient should take ownership of their own disease. You should read or listen to anything you can lay your hand on when it comes to your diabetes, so that you become your own expert. In that sense, you'll be able to make demands when you go to the clinic and to confront your healthcare workers when they are not doing the right thing. But also us as healthcare workers, we need to be more compassionate. We need to strengthen our skills, and we need to understand that diabetes is a condition that not only affects the body, but also the mind and the mental health of the people with diabetes. And those are the skills that we need in order to have positive interactions with our patients.
Sure, absolutely. It's on that optimistic note we're going to have to leave it. I found this incredibly enriching. I'm hoping somebody listening has also been able to benefit from that. Dr. Patrick Piotie, really appreciate your time, the chairperson of the South African Diabetes Alliance, and in front of me, Dr. Judey Pretorius, who's the managing director and biomedical scientist with Biomedical Emporium. May there be many, many, many more discussions like this, not only on World Diabetes Day. Once again, thanks very much indeed.
Thank you very much.